What are the stimulant drugs used to treat ADHD? Methylphenidates, amphetamines. So how I remember it is that if the drugs have pH in it, then they are stimulants. But if they don't have pH in it, like clonidine, then they are non-stimulants. What is the treatment of choice of leptospirosis? Doxycycline. Recall that this medication is also used to treat Lyme disease if the patient is greater than 8 years old. If they are less than 8 years old, then we use amoxicillin. Doxycycline can also be used to treat Rocky Mountain spotted fever. What are the drugs of choice for endometritis? So this can be remembered with the mnemonic ECG. Endometritis is treated with clindamycin and gentamicin. ECG, clindamycin and gentamicin. Which antitussive is a coding analog and may cause serotonin syndrome? Dextromethorphan. What drugs can cause digitalis toxicity if they are used together? Amiodarone, verapamil, quinidine. So acute toxicity with digitalis can present with GI symptoms such as anorexia, nausea, vomiting, abdominal pain, while chronic symptoms present with neurological symptoms such as blindness, weakness, and scotomas. What diuretic can worsen or cause gout? Loop diuretics. What drug is a mucolytic and an antidote for acetaminophen overdose? N-acetylcysteine. What condition can present after 6 days of phenylephrine use? Rebound congestion. Recall that phenylephrine and pseudoephedrine are alpha agonists that are used as nasal decongestants. However, when you use these medications, it can result in hypertension and CNS stimulation and anxiety. What drugs can cause agranulocytosis? Well, you can remember this as AC. So antithyroid medications, clozapine, carbamazepine, chloramphenicol. So you can remember with this image right here of the 3 air conditioners. Also recall that chloramphenicol can cause gray baby syndrome. Which drugs can cause photosensitivity? Sulfonamides, amiodarone, and tetracyclines. You can remember this by saying, I sat for a photo. What is the first-line treatment for bulimia? Fluoxetine, which is a SSRI. What are 3 herbal supplements that can increase the risk of bleeding? Garlic, ginseng, and ginkgo biloba. Probably pronounced those incorrectly, but let's look at the spelling here on the screen. Which antidiabetic should be held before doing a CT with contrast? Metformin. Recall that metformin is a biguanide And one of its very famous adverse side effects is that it can lead to lactic acidosis. So because of this risk of lactic acidosis in patients with metformin, the contrast can further potentiate this lactic acidosis, making it very dangerous for patients. So what is recommended is that metformin is withheld from the patient before doing an imaging test that requires contrast. Which drug can be used in the management of chronic myeloid leukemia? Imatinib. What is an antidote for this substance? Fresh frozen plasma, vitamin K. What is the drug of choice for leishmaniasis? Sodium stibogluconate or amphotericin B. Recall that this condition is transmitted by sandflies. What drugs can cause pulmonary fibrosis? Busulfan, bleomycin, amiodarone, methotrexate. I'm sure that you can list other drugs that cause pulmonary fibrosis. Please list them in the comment section below. What is the treatment of choice of pertussis? A macrolide. So this is also used for prophylaxis for close contacts as well. What drugs can cause drug-induced Parkinsonism? Dopamine receptor antagonists. And of course, metoclopramide has some dopamine blocking effects as well. And it's important to note that these drugs can also lead to neuroleptic malignant syndrome. What is first-line treatment for trigeminal neuralgia? Carbamazepine. It inhibits neuronal high-frequency firing by reducing the ability of sodium channels to recover from inactivation. So it's very important that I mention the mechanism of action here because this question is so common on exams and on the USMLE. So instead of just listing carbamazepine, they've started to list the mechanism of action of the drug instead. So just take a closer look at this and commit this to memory. What antihypertensive agents are safe to be used during pregnancy? Hydralazine, labetalol, alpha-methyl-dopa. And a lot of people remember this by saying hypertensive moms love nifedipine. Hypertensive for hydralazine, moms for methyl-dopa, love for labetalol, and N for nifedipine. Hypertensive moms love nifedipine. Very high yield to note this. What are signs of phenytoin toxicity? Nystagmus and gait unsteadiness. What anti-anginal agent is used to treat chronic exertional angina refractory to conventional medical therapy? Ranolazine. How do you manage someone with HIT or heparin-induced thrombocytopenia? Stop heparin, then administer direct thrombin inhibitor. What is the treatment of choice of pyelonephritis? Ceftriaxone. Which anti-diabetic drugs increase the risk of UTIs? The anti-diabetic drugs with flo in it. So dapagliflozin, empagliflozin. What is the first-line treatment for malignant hyperthermia? Dantrolene. This blocks the receptors and prevents the release of calcium into the cytoplasm of skeletal muscle fibers. What possible side effect can result from using statins and fibrates? For example, atorvastatin and gemcitabine. Well, this increases the risk of myopathy in patients being treated for hyperlipidemia. What is the drug of choice for mastitis? Nafcillin or dicloxoxilin. So mastitis is most commonly caused by Staph aureus, and patients with mastitis present with fever and unilateral breast tenderness. What is the treatment of choice for carcinoid syndrome? Octreotide. What is the treatment of choice for close contacts of meningitis patients? Rifampin or ceftriaxone or ciprofloxacin. So let's say that a patient has meningitis and they were in close contact with a patient that is pregnant. Which of these medications would be appropriate to give that pregnant patient? Leave it in the comment section below. Which anti-diabetic drugs can cause weight loss? GLP-1 agonists such as exenatide and DPP-4 inhibitors such as the gliptins. What is the treatment of choice for a UTI in a pregnant patient? Nitrofurantoin or fosfomycin. It's very valuable that you remember that you should not give drugs such as ciprofloxacin because they have teratogenic effects. So no fluoroquinolones for pregnant patients. How do you treat a patient that presents with clinical features of this condition? Basically, you want to take care of your ABCs. So you want to secure the airway, provide IV fluids, and the first line treatment is with atropine. However, if the patient is refractory to atropine or isn't seeing the clinical improvement, then you can go ahead and give glucagon. So for patients with this condition, they present with bradycardia, hypotension, wheezing, hypoglycemia, delirium, seizures, and cardiogenic shock. So typically, IV glucagon is second line if there is profound or refractory hypotension. What is the treatment of choice of otitis externa? Fluoroquinolones. What vaccine should patients who take eculizumab receive? These patients should be vaccinated against Neisseria. And basically, you need to remember that eculizumab is a monoclonal antibody against C5. So patients who take this medication or patients with terminal complement deficiency should receive their vaccine against meningitis, specifically for Neisseria. because the complement is needed to basically fight or combat this organism. What is the mechanism of action of vincristine? It inhibits polymerization of microtubules. Another high yield thing that examiners like to test is the adverse side effects of vincristine, and that is it can cause peripheral neuropathy. What is the treatment of choice of otitis media? Amoxicillin and clavulanic acid or cefuroxime. So recall that for otitis externa, it is treated with fluoroquinolones, while for otitis media, it is treated with amoxicillin and clavulanic acid or cefuroxime. This is very high yield, particularly for patients who are not patients, for applicants who are doing the USMLE Step 3, especially for day 1, you can be heavily tested on antibiotics. If you want to see a higher review on antibiotics, let me know in the comment section below. What class of drugs cause cartilage damage? Fluoroquinolones such as ciprofloxacin and levofloxacin. Administration of sodium nitroprusside can cause the accumulation of what element? Cyanide. So it's very important to look out for, excessive accumulation of cyanide presenting in patients because, for example, if a patient comes in and they have hypertensive emergency and you administer nitroprusside, you need to be aware of this adverse side effect. Another common cause of cyanide poisoning is a house fire, and these patients usually present with lactic acidosis, altered mental state, and cherry red macula. What vitamin can be used in the treatment of methylglobinemia? High dose ascorbic acid. So basically, to manage this condition, you need to discontinue any medication or drug that could be causing it. And also, you need to give methylene blue. However, it's high yield that you remember that methylene blue is contraindicated in cases such as G6PD deficiency. Basically, methylene blue acts to reduce methemoglobin to hemoglobin, and vitamin C is also a reducing agent. What is the first line treatment for toxoplasmosis? So to treat this condition, you would need to use these drugs listed here. What is a potential side effect or complication of using fibric acid derivatives and bile acid binding resins? They increase the risk of cholesterol gallstones. What is the best next step in a patient who is in anaphylactic shock and that is unresponsive to their first dose of epinephrine? Give another dose of epinephrine. What are early signs of toxicity with this drug? GI symptoms such as nausea and vomiting, lethargy, respiratory depression, and QT prolongation. What is the treatment of choice of histoplasmosis, blastomycosis, sporotrichosis, and coccidiomycosis? Itraconazole. Which antiretroviral causes vivid dreams? Efavirenz. What is the treatment of choice of entamoeba histolytica? Metronidazole. So recall that patients with entamoeba histolytica can present with bloody diarrhea and liver abscess. Is doxylamine more sedating than desloratadine? Yes. So recall that the second generation antihistamines are less sedating. So I remember these or this concept with the S's. So basically doxylamine is a first generation H1 blocker, while desloratadine is a second generation H1 blocker. So second generation H1 blockers are less sedating. So how examiners test this concept is, for example, you have an elderly patient and they need to be treated with antihistamine, and they will list drugs and they're all antihistamines. And you have to determine which one is less sedating. Because typically for elderly patients, you want to give them those less sedating drugs. What is the drug of choice for nightmares and PTSD? Prazosin. Prazosin is an alpha blocker that was initially used to treat hypertension, but now it's more commonly used to manage symptoms of BPH and nightmares associated with PTSD. To continue learning more high-yield concepts for the USMLE, just click this video right here.